Are you curious if you are pregnant and wondering what signs to watch out for? Or could you be pregnant and not even know it yet? In this video, I will help you identify the early pregnancy signs and implantation signs that you need to watch out for, how soon you might experience these signs, and when is the best time to take that pregnancy test. Hello, guys. My name is Dr. Raisha, and this is the fertility series with Dr. Raisha. Let us first try and understand how pregnancy takes place. So, every month at the beginning of your menstrual cycle, the brain sends a hormone called follicle stimulating hormone to the ovaries, telling the follicles to grow. Each follicle contains an egg. Now, towards the middle of the menstrual cycle, another hormone is released all of a sudden. We call it a surge of luteinizing hormone. And this causes the follicles to release one egg. And this is what we call ovulation. Now, the egg travels into the fallopian tube, meets the sperm, and fertilization occurs to form a zygote. If there is no sperm, the egg will disintegrate and be absorbed by the body, or it will be expelled during menstruation. Now, in this case, we are assuming that there was sexual intercourse and there is a sperm and the egg is fertilized. Now, we have a zygote and it starts traveling towards the uterus. Now, during this time, the zygote is dividing into multiple cells, forming what we call a morula. It keeps dividing and dividing, forming what we call a blastocyst. Now, 5 to 7 days after ovulation, the blastocyst reaches the uterus. Now, anywhere from day 6 to day 12, the blastocyst implants into the uterus. We call this DPO, that is days post-ovulation. For most women, implantation occurs on the 8th day, the 9th day, or the 10th day after ovulation. After the blastocyst has implanted itself into the uterus, it starts releasing HCG, and this is the hormone that is detected by that pregnancy test, giving you 2 lines. Now, you only start experiencing pregnancy symptoms after implantation occurs. Before implantation, there are no noticeable signs of pregnancy because the body has not yet begun producing the necessary hormones such as HCG that trigger these pregnancy symptoms. What are these signs that could tell you that you are pregnant? The first sign is implantation bleeding. As the blastocyst is implanting into the uterus, it forms some projections and burrows into the uterine lining. Now, these projections may dig into blood vessels, causing them to break and hence some light bleeding. Now, this blood is light, more so like spotting, and lasts from a few hours, a day, or even 2 days. Most women really panic when they see blood when they are pregnant and think that this is their monthly period. And you know what it means when you see your monthly period? You are not pregnant. Now, how do you differentiate between implantation bleeding and your period? Implantation bleeding is typically light and does not last as long as your normal period. It might last anywhere from a few hours to 2 days. A period, on the other hand, usually starts light but gets heavier and lasts for around 4 to 7 days in most women. Now, the blood is usually pinkish or brown rather than the bright red blood associated with your regular menstrual flow. And the flow is very light, often just spotting, and does not increase in intensity like your period might. You may notice it when wiping yourself or as light staining on your underwear. Implantation bleeding typically occurs around 6 to 12 days after ovulation, while menstrual bleeding occurs about 14 days after ovulation. If bleeding occurs earlier than expected, it could be implantation bleeding. But for women with shorter menstrual cycles, it may become a little bit confusing. To determine whether the bleeding is due to implantation or an early period, it is helpful to compare the timing, the duration, and the flow with your previous cycles. Another sign is abdominal cramps. Now, this occurs 6 to 12 days after ovulation, that is during implantation, as the embryo burrows into the uterine lining and is, making itself comfortable, it can cause some minor inflammation and stretching of the uterine tissues, leading to cramping. Now, this is usually accompanied by light bleeding, what we have called implantation bleeding. After implantation, the progesterone levels rise significantly, and this leads to a whole lot of symptoms such as breast tenderness and soreness, and breast enlargement, fatigue, nausea, that is, feeling like vomiting, drowsiness, constipation, and mood swings. Now, some women experience symptoms such as breast tenderness, fatigue, and nausea during ovulation. Now, which can be confusing and make it difficult to differentiate from early pregnancy symptoms. Additionally, women undergoing IVF treatment are given progesterone, which can also cause similar symptoms. Now, this overlap can make it challenging to determine whether these signs are due to pregnancy or simply a side effect of the treatment. To distinguish between these possibilities, you should consider the timing and the duration of these symptoms. Now, symptoms occurring after ovulation and lasting until your menstruation might be related to the luteal phase. In contrast, symptoms that persist beyond a missed period, you miss your period and the symptoms continue persisting and starting around a week after implantation, are more indicative of an early pregnancy. For those undergoing IVF, symptoms may begin shortly after starting progesterone supplements and may overlap with early pregnancy signs. Now, when is the best time to take a pregnancy test? Implantation must occur for HCG to be released, typically between 6 to 12 days after ovulation. Now, HCG is the hormone that is detected by a pregnancy test and is only present in detectable levels once implantation has occurred. Now, after implantation, HCG levels rise rapidly, doubling approximately every 48 to 72 hours. Although some tests may detect HCG shortly after implantation, the most reliable time to take a pregnancy test is 14 days or 2 weeks after ovulation. This timing ensures that implantation has occurred and that HCG levels are sufficiently high to be detected by the test. It is important to remember that every woman's experience with pregnancy symptoms can vary. Our bodies are unique and individual responses to pregnancy can differ. There are some women who do not experience any of these symptoms, but when they take a test, they find out that they are pregnant. And other women experience these symptoms before the 6 days after ovulation. And when you take a test, they find out that they are pregnant. If you are trying to get pregnant and you are waiting to take that pregnancy test after ovulation, I want to wish you all the best. In most women, the signs that we have talked about usually intensify and become more noticeable after your missed period. You get more fatigue, breast enlargement and tenderness, nausea, vomiting, what we call morning sickness, frequent urination, drowsiness, and constipation. And if you want to know how to calculate your menstrual cycle length, your safe days, and your fertile window, I am going to leave that video over there. But don't click on it just yet. Please subscribe if you want to keep learning more with Dr. Raisha. Okay? See you over there.